John Marshall for Oncology Unscripted. Big new paper coming out of JAM. It's actually a review article. Really, really smart people and friends up at Boston, where they looked at this. We all see it, this emerging trend of younger and younger people getting all kinds of cancer. This particular paper was around all kinds of cancer, but we're clearly seeing it in GI cancers. And we don't really understand what's going on, but we see it. It's impacting in our clinic, maybe first recognized in the colon cancer clinic, but we're seeing it in other clinics as well. And, we have two kind of schools of thought of why this is happening. On one side, we've got the sort of traditional, here's who gets cancer list. So you have a gene, you've inherited it, or you have some behavior that increases your risk, or you're overweight or something, right? That you have some known risk factor that we all learned in medical school that's causing this cancer. Now, if that were true, then our normal 60-40 split of cancers, 40% on the right side, 60% on the left side, would be true in colon cancer. But in fact, most of these young people with colon cancer, it's up to like 90-something% all have rectosigmoid cancers. And so what the heck's going on? And most of the patients that we see, at least that I see here in Washington, D.C., don't have any of those things on the list that we all memorize. They're all very fit. They have no real reason to have this, no strong family history, and certainly no gene. So we are looking for novel explanations. The leading one right now has mostly to do with microbiome and understanding what that's all about. And we're not going to drill down on that today, but we are looking for the explanation as to why. Now, the other piece that goes with this is that if you're a young person, is your cancer better? Well, it actually doesn't look that way. If anything, it looks like it might be worse. We know that we fail to diagnose it earlier because it's not on our radar. If I'm in an urgent care clinic or in an ER or something or even a patient with the symptoms, you don't think to yourself, oh, I could have colon cancer, because you're 40 years old and it's too young to have colon cancer. So it isn't better cancer. But on the flip side, because you're younger as a patient, doctors tend to be more aggressive. They tend to push treatments harder because young people can take it. Well, on the flip side of that, they also have much longer to live if we give them some sort of permanent toxicity, say neuropathy from oxaliplatin. So it's clearly its own thing. It has its own impact on day-to-day living for these people because they have to keep working, because they need health insurance here in the United States. They have to tell people about it. So the impact on their lives is much bigger than, say, if you're a retired 73-year-old with a good support system. So that impact is a bit worse. The disease probably is worse. The failure to diagnose is worse. We don't really know what the biology and the cause is, and more isn't necessarily better. So there's a lot to talk about and think about. So take a look at this paper, see the emerging trends, share it with your colleagues in other areas of healthcare so that they're aware of it too. John Marshall for Oncology Unscripted.